Hi, this is Deborah Wittenborn. This is my reflective blog for Module 3 of Nursing 406. At first glance, the facility I work for has a horizontal organizational structure. However, since working there, I realized there is an entire line of structure missing on the org chart. There is a direct line from the CEO of the hospital to the vice presidents for each major branch within the organization. This is the org chart. As you can see, the CFO is in charge of, the CFO, which is down here, is in charge of various departments related to the finances of the health system. The COO is connected to facilities and environmental services, as well as many other departments. The CNO oversees the nursing units and all things connected to patient care, the CMO, the physician groups, and so on. In reality, the structure of the health system is better described as vertical, as there are directors and managers that also make up the hierarchy. This would be all down here, and it doesn't appear on any of the org charts. There does exist a matrix structure within the health system, as the units within the hospital belong to different departments that share common goals that affect the organization as a whole, as quoted by Grower, Murray, and Langland 2011 on page 133. As a nurse, I know that each patient care unit puts the patient first and strives to do no harm for the good of the whole system. I feel that the top heaviness of the structure somewhat impedes the staff's ability to care for patients with transdisciplinary collaboration. The vice presidents and directors are inaccessible within the structure, resulting in the flow of communication to be muddied as individuals work their way up the hierarchy from team leader to supervisor to manager and so on. It is similar to a bad game of telephone that children play. The message gets lost when the direct avenue to communication is taken away. As a staff nurse, I am located at the bottom of the organizational structure. The next level would be team leader, then supervisor, manager, director, as I work my way up. In the article, Measuring the Quality of Transdisciplinary Teams by Beta Baderwitz and Tracy Shepard, the healthcare model, as quoted, literature defines and describes 3 different types of teamwork practiced in healthcare, including multidisciplinary, interdisciplinary, and transdisciplinary. The article goes on to describe the advanced strength of teamwork each level dictates. Transdisciplinary teamwork being the highest level, where the interdisciplinary team works to communicate and collaborate the care of the patient as a group rather than individually. This method combines the skills of each professional on the team for the best patient outcome. The method of teamwork is not modeled in the facility where I am currently employed. I feel that the more vertical model of organizational structure does not allow for the blurred lines between professionals required for this level of team collaboration. This is not to say that I think that patient care is suffering because of this. The model of care that at the facility I work for is something I'm very proud of. The healthcare organization is striving to be the community's medical home and utilizes a primary nursing structure that leans more toward total patient care. As an RN, the responsibility for the patient falls on me to collaboratively plan and care for a patient or group of patients. If I were the next level up in the structure, my responsibility would extend to managing the RNs and CNAs caring for the patient. This would include hands-on assistance for the staff as needed. Being a higher level manager within the current organization, I would be in charge of 1 to 3 groups of employees. The leadership skills questionnaire demonstrated that I was high in administrative skills and very high in interpersonal and conceptual skills. I was somewhat surprised how close to equal I was in each set of skills, but I was unsurprised to discover that my interpersonal skills were the highest. I feel that my sensitivity to differing personalities, my conflict resolution skills, as well as what drives my passion for nursing and the success of the organization, allows me to relate to others easily and lead by example. I hope this would be recognized from my subordinates and motivate them to work for the greater good of the patient as well as the facility. I feel this sensitivity extends to the mission, goals, and values of the healthcare facility. I feel that an effective manager works with all levels and departments in some way. In the cardiac catheterization lab, it would be important for me to interact with all levels under the CNO and CMO, as this is directly related to patient care. However, HR, facilities, and finance also play an essential role in the care of the patient as well as the staff. For me, a horizontal structure is more appealing as it is a streamlined approach to running the healthcare organization. I feel that the more people in charge, the more likely the values of the healthcare organization will be compromised, ultimately affecting the care of the patient. Thanks for listening.